pain changes who you are as a person. When you're distracted by it, with it being a constant thing, it takes your thought, it steals your energy, it makes you less than what you want to be in every area. And that was something that I wasn't willing to do anymore.
When people come to my office with a low back problem and learn that I have recommended that they have a lumbar fusion, they're surprised that I tell them that they can get back to better than they were before. The fear that they're going to lose all mobility with a one-level fusion, that's just not true. I have several patients that are actually way better than they were prior to surgery or even 10 years before surgery.
I went into his office in a wheelchair. I'd had some mechanical work done and turned on the I-110 and the tie rod broke. It's a miracle that I'm here. You know, we see other people in wheelchairs and we don't understand what things look like, and being in a wheelchair, everything looks completely different.
I injured my disc almost 16 years ago with the delivery of my first child. Out May of this past year, it was different. Tingling, numbness in my left foot, and from there it became a constant pain issue in my left leg, and it just would not go away.
I'm Dr. Mark Giovannini. I'm a board-certified neurosurgeon. I specialize in minimally invasive spine surgery.
I'm very active. I've always been a big one going to the gym. Working out's a big thing, doing gardening and playing with my grandchild, very physical. And I was probably 100% debilitated. I'm Kay Spangler. I live a very active lifestyle. I love to dance, I love to go to the beach, and I love watching football. Dr. Giovannini performed a lumbar fusion on me. I thought I would probably die. I was consumed, completely consumed with the pain. My friends were very supportive. My boyfriend missed his girlfriend and was so used to me being outgoing and dancing and laughing. Gio looked at the MRI and he said, "I can fix that." I said, "I love you." Everything went very smoothly, and I'm pain-free now. When I went in for my last checkup, I walked in and he was sitting there and he says, "You're good to go." And I said, "But I have a question." And he says, "You're good to go." I said, "But seriously," I said, "What about sex?" I said, "My boyfriend's sitting out there and I haven't had sex in 8 years until I met my boyfriend." "Yes, absolutely, you're not gonna break anything."
It's all done through about a dime-sized incision. Dr. Masson has developed this technique called Emergent, which is the technique that we use now to perform this ultra minimally invasive lumbar interbody fusion.
I'm Pam Heron, and I get to live pain-free because Dr. Giovannini performed an outpatient, minimally invasive lumbar fusion on me. Yes, within just a few hours, they had me up walking at the hospital, and then I came home in my husband's truck, and I walked through my garage and up 5 stairs into my house and didn't have any difficulty whatsoever.
Because of this technique, the recovery is a lot faster, patients get back to what they want to do faster, and the post-op pain is much less. Coached properly, they can go home the same day.
There's no reason to be scared. There's no reason to let your fear keep you from doing something that's going to make your life so much better.
The beauty of this procedure is that there's virtually no complications. In the small incision, there's virtually no blood loss, and the chance of infection is much lower than a typical open procedure. So the procedure itself basically is done through a dime-sized incision. We use fluoroscopy to track everything, and we also use the microscope to do everything ultramicroscopically. Essentially, we make this small incision, then we place the pedicle screws in. That's the first step. The pedicle screws are placed through the same incision with plastic surgery type techniques. Once the pedicle screws are placed, then we focus on putting the inner body graft or the cage in the disc space. And then the cage is placed after taking all the disc out or most of the disc out, and then we decompress the spine and then finish the procedure by putting the rods in and then doing a little bit of a fusion on the lateral portion of the spine.
After 15 years of dealing with pain in one way or another, it's nice to rediscover who I am without it. I hope this makes me a more active mom, a more fun mom, a better wife, a better employee, a better daughter. And at the point that I had my surgery, I wasn't doing any of those jobs very well. Being 3 months out from something that I've waited 15 years to do, my only regret is that I waited the 15 years to do it.
I walked out of there dancing across the parking lot.